Okay, so Maddie, Olivia, and I have the topic drugs not prescribed by the dentist. And the first drug that we're going to be talking about is caffeine. It is a habit-forming stimulant, and people may not know if they are addicted to caffeine. It involves coffee, tea, soda, and energy drinks. It causes the heart to work faster and harder and may affect the nervous system. If a person were to drink 30 double shots of espresso, which is a lot, or 70 to 100 cups of coffee, the result could be fatal. Teeth are often stained from too much caffeine. That's why they tell us not to drink any soda often and stick to things like water. It has been linked to anxiety and sleeplessness, and withdrawal side effects may occur. Caffeine can come in a 200 milligram pill, and this can also be known as alertness aids. It is the most popular mood-altering drug, and a little fun fact about caffeine is that it can be found in unusual products like shampoos and weight loss products. On the next slide here, we have a chart that just shows how many milligrams of caffeine is in each drink. There is a coffee side, and then there's like a soda / energy drink side. And as you can tell here, the Starbucks tall coffee has the same amount of caffeine as an energy drink, which is over the 250 milligram mark. And the average healthy person can have up to 400 milligrams of caffeine a day. Roughly, that is the amount of caffeine in 10 cans of soda and 2 energy drinks. Next, we're going to be talking about nicotine. It is a stimulant that speeds up metabolic activities. It is not used to treat disease and has no useful purpose. Some of the side effects built over time include cancer and heart disease. Heart disease is actually the #1 cause of death in the US today. Tobacco smoke contains carbon monoxide, which means this gas does not allow the blood to obtain the correct amount of oxygen needed. This makes the heart and circulatory system work harder. And smokeless tobacco, which is chewing tobacco, has a high risk of oral cancer, which some of the factors include tooth staining, periodontal disease, and halitosis. And many dental offices are unlikely to hire a dental assistant who smokes, since we do focus on oral health. The next drug we're going to be talking about is alcohol. It is a depressant that slows down the body processes, and it is one of the oldest drugs known. It affects the body functions because it is absorbed through the bloodstream. You may experience slowed reactions, slurred speech, and loss in coordination. And this is one of the only drugs socially acceptable in society today. Some of the side effects include liver deterioration and malnutrition, and people take alcohol to overcome the fear of dentistry. And according to the National Highway Traffic Safety Administration, every day 28 people are killed by an alcohol-impaired driver, which is awful. And as a dental assistant, we must be alert because of harmful interactions between alcohol and other drugs used in dentistry. On the next slide, we have a picture of the long-term effects of alcohol. As you can see, it affects many parts of the body over time, which includes the nervous system, the circulatory system, pancreas, intestines, the reproductive system, the throat, the liver, and the stomach. And it can get very serious over time.
Next, we have marijuana. Marijuana is the only drug that acts as a stimulant and as a depressant. The side effects would be an increased heart rate, which is why it's a stimulant, but it also slows down brain function, which is why it's a depressant. Over a long period of time, it can lead to lung tissue damage and even reproductive system disorders. This is unlikely to become physically dependent, but it's very common to become psychologically addictive. Marijuana has more recently been used to decrease nausea for cancer patients. On the next slide here, you can see how it's been used recently across the board in different states. Illinois just legalized the use of recreational marijuana at the beginning of this year. Next, we have cocaine. Cocaine is a stimulant. It's an extremely habit-forming drug that would cause a physical and psychological dependency. It gets the nickname rich man's drug because of the cost. Even a day's dose can be hundreds of dollars. Side effects are heart problems, mental disorders, violent behavior, anxiety, and death. It's often mixed with other drugs. From a dental assistant standpoint, it's good to watch for different side effects that can happen in your teeth, in your gum tissue, and stuff like that from the different use of drugs. For cocaine, it would be abrasion that is similar to toothbrush abrasion, but it's over a wider area, and permanent damage can occur on the mucosa and also on the teeth from this. Next, we have narcotics. These are commonly called painkillers because of their use to frequently relieve pain. They are a depressant, and they cause physical and psychological dependency. 3 types of narcotics are heroin, morphine, and codeine. All of these drugs have been used for thousands of years. They've been adapted and changed and replaced by less addictive drugs over the years. From 1999 to 2017, almost 400,000 Americans lost their lives from opioid addiction. It's been a lot of different changes for post-op drugs and different options because of how addictive morphine, heroin, and codeine have been over the years. Heroin is the most addictive when patients attempt to withdraw. Usually they're sick within even the first 12 hours. Next is morphine. This is one of the most common painkillers. It's usually found to control postoperative pain, but it can lead to nausea, which is part of the reason why you're not supposed to eat before a big operation, but you still can feel sick after. And this causes physical addiction. And codeine used to be used for a cough suppressant. It induces drowsiness, and it can lead to a physical and psychological addiction. Currently, about 130 Americans die every day from opioid overdose that usually starts with just a post-operative medicine. Next, we have amphetamines. Amphetamines are a stimulant. They increase your heart rate and also your respiration. It can lead to a loss of appetite, nervousness, poor judgment, and violent behavior. In the past, this was used as a weight loss tool, and currently it is used to treat narcolepsy and ADHD. It's a stimulant, but when it's used on a hyperactive patient, it can actually have the opposite effect, and it can be calming, which is why we use it for ADHD patients.
So we have methamphetamines. They were developed in the 20th century. They are used as a stimulant, also used to treat ADHD and for short-term weight loss. It's a controlled substance, and it has side effects that include rapid or irregular heartbeat, delirium, panic, psychosis, and also heart failure. Then you have hallucinogenic drugs. So as you can tell by the screen, your mind's not sure where to focus. You're seeing all different kinds of things, and your mind is just kind of playing a game with you. So this is a psychoactive agent that causes someone to hallucinate, see perpetual anomalies, or other changes in thoughts, emotions, and consciousness. LSD is the common form of a classic hallucinogenic drug, and PCP is the most common form of a dissociative hallucinogenic drug. Those are the 2 most common names that you probably heard, but there are multiple other ones that are out there. Both of these and the rest of them have multiple side effects, some including nausea, increased heart rate, change of time, which means going slow or fast or not sure what year it is, what month it is, or anything. They can also have spiritual experiences and much more, this meaning that they could see what they would call demons or ghosts or God or other things that actually aren't there. And then you have barbiturates, and as you can see by the pill, it says Butasol. That's probably one of the most common names that you see or have heard of before. It controls the central nervous system. They reduce activity-causing relaxation, which is also why they may be called a chill pill. They reduce heart rate, blood pressure, and control the breathing. They are often prescribed for insomnia, headaches, and/or seizures. It is one of the older classified medications compared to the new ones that they have made, such as Xanax. Side effects include nausea, dizziness, sedation, relaxation, vomiting, or abdominal pain.